Do you know that skin disease may affect 1.9 billion people? Today, our video is going to discuss about 3 very common skin problems, which are dehydrated or dry skin, eczema and acne. Actually, these 3 problems are quite related to each other. In stressful, hectic lifestyles, with skin exposure to changing humidity and temperature, our skin may be dehydrated. Without proper management, it will progress to form dry skin, which would look dull and itchy. People may scratch the itchy area, increasing the risks of skin inflammation, which may lead to acne, or even eczema. Next, let's talk about how these skin problems develop. For dehydrated and dry skin, you might think it is the same condition, but actually it is not. Dehydrated skin means that skin condition is lacking water. It can be dry, itchy and dull looking, which can develop to become dry skin if left untreated. Dry skin is an uncomfortable type of skin marked by scaling, itching, and cracking. Dehydrated skin may be triggered due to genetic predisposition, environmental or humidity changes. When this happens, the retention of water in the skin will decrease and may cause it to damage the skin barrier, showing signs of flaking and prone to wrinkles and lines. Dehydrated skin and chronic dry skin will send signals to somatosensory of itch and cause itchiness, which may lead to scratching, then developing other skin inflammatory problems. Next, eczema. Eczema is also known as atopic dermatitis, AD. It is an inflammatory, chronically relapsing, non-contagious and extremely pruritic skin disease. It might be triggered by genetic predisposition, infection, and skin dehydration and lead to defective barrier-initiated mechanisms. This will increase the invasion of allergens and transepidermal water loss, resulting in increased level of cytokine release. Cytokines are chemicals that may cause inflammation, and this may result in dermal inflammation with immunological abnormality. When released prolongedly, eczema may be triggered. Finally, acne. Acne is a very common, chronic inflammatory disease of the pilosebaceous unit, which means it affects the hair and sebaceous glands by and commonly occurs at puberty, but is also observed in adults. It all starts due to the active sebaceous gland activity, due to the circulating androgen hormones in the body, paired with the abnormal keratinization around skin, due to the buildup of the stratum corneum of the skin. This may lead to follicular plugging, and formation of comedones. Hence, the proliferation of commensal bacteria within the follicles induce inflammation to occur, finally leading to acne. There are few supplements that are recommended to treat the mentioned skin problems. 1. Probiotics. Probiotics contains lactobacillus species such as L. rhamnosus and L. reuteri are found to be able to reduce the severity of eczema and acne. This is done by inhibiting the T helpers L type 2 mediated response, which produces the pro-inflammatory cytokines. Probiotics are safe to take on a long-term basis without causing dependency or indication. 10 billion CFU per day is the general dosage tested for adults. For kids, the research doses are typically about 5 billion CFU per day. 2. Fish oil. Fish oil contains EPA and DHA. It is particularly useful in eczema and acne. For eczema, it can help to inhibit arachidonic acid inflammatory pathway to inhibit skin inflammation and hence relieve symptoms. For acne, it can help to regulate hormones associated with acne and regulate skin's oil production to relieve acne. The reference daily intake of combined EPA and DHA is 200 to 500 mg. Typically, 1,000 mg of fish oil supplies around 300 mg of combined EPA and DHA. 3. Collagen and vitamin C. These two are particularly useful for dry skin. For collagen, there are 2 types of supplements, which are collagen hydrolysate and gelatin. These supplements help to stimulate the collagen synthesis as well as elastin and hyaluronic acid, which helps to bring hydration to the skin. The recommended daily amount of collagen for adults is 2 g to 15 g per day. The safety of collagen child use is not widely assessed. For vitamin C, it is absolutely essential for synthesis of collagen. The recommended daily amount of vitamin C for adults is 65 mg to 90 mg per day and the upper limit for the dose is 2000 mg. For children, the recommended dose is 14 mg to 45 mg and the upper limit is 650 mg to 1200 mg a day. Thanks for watching the Public Health in 4 Minutes series. We appreciate your time and support towards our series this year. See you soon.